Children have not just the three-dimensional problems that we have in adults, but they have a fourth dimension. And that fourth dimension is growth. We have to provide a solution that will be able to grow with the patient.
We're always asking ourselves one simple question, which is what is best for the patient and the family. At other hospitals, patients might see a medical specialist, and then subsequently they will see a surgical specialist, and they might see a psychologist, and they'll see a social worker, and each one of these is a separate trip. So what's different here at the Children's Hospital at Montefiore? From the point of view of a patient, being looked after by a team that is truly integrated, that's a unique experience for patients.
No other institution in the country has a clinic that brings together a geneticist, a cardiologist, a social worker to meet with families and discuss these issues. Last week, we had a family who came. We had identified a mutation in the long QT syndrome type 3 gene, and sitting in a room with that family was myself, a pediatric cardiologist, and an adult cardiologist, and we spent an hour talking with this family about the implications of the finding.
Well, I think the hybrid approach is a good example of how we're using team care here at Montefiore to deliver the state-of-the-art care to children and infants with congenital heart disease. Traditionally, surgery has been performed in babies with the most complicated heart defects very soon after they're born. And as you can imagine, that is difficult to do because the babies are quite small and often quite ill.
Last week, a child came through the hospital, born at one of our referring institutions. A diagnosis of interrupted aortic arch with ventricular septal defect was made. It was a very complex form of it, and in the early morning, Dr. Weinstein, who's our cardiac surgeon, me, Dr. Sue, our chief, Dr. Lamore, and Dr. Leo Lopez, who's the director of the Echo Lab, sat around the table, looked at these images. This is the type of thing that would not happen at my old institution. We all decided as a team that the best option for this child was to undergo a hybrid procedure. Within 4 hours of that meeting, we were in the cardiac cath lab doing surgery and a cath together. Dr. Weinstein opened the patient's chest. He put pulmonary artery bands on the right and left pulmonary arteries, and then he placed my vascular sheath in the main pulmonary artery to allow me the opportunity to stent the patent ductus arteriosus. And in so doing, we basically stabilized the circulation, and the patient no longer needed to have bypass surgery. So there was no circulatory arrest, there was no cardiopulmonary bypass, and the patient was extubated from the ventilator within 24 hours, and now 5 or 6 days later is almost ready to go home.
The kind of people that are leading programs in the Children's Hospital would not be here without a School of Medicine of the caliber of the Einstein School. The only way you develop new knowledge is by making connections between the science and the care. The school is superb. Montefiore's medicine, it's like a mirror image. It's innovative, it pushes the bounds in terms of new knowledge. It is clinically superb. The outcomes here are outstanding. So when you marry those two, you create an environment where the whole is greater than the sum of the parts. As we build programs in the Children's Hospital and connect them with the Albert Einstein College of Medicine, we are relentless in terms of how we grade ourselves. But when you hit the U.S. News and World Report in the top tier, you stand back and just say, wow.
The hospital's made a great commitment also to say that we're going to take cardiology care we deliver to children to the next level, which is going to allow us to say to children who are cared for by us, we can take care of you whatever happens to your heart.
What we're doing is building teams across the entire spectrum of biomedical science. Our goal is to be a national leader in transforming child health. And to do that, we have to not only offer supreme clinical expertise, we also have to train the next generation of physicians and scientists, and we have to lead the discoveries that can help to transform the health of children. Innovative science plus cutting-edge technology plus supreme clinical expertise, all integrated in the context of a family-centered approach, is what we aim for. And that's part of what makes this place a special place.